And I just want to pipe in here because I'm like the colorectal cancer encyclopedia, but 13,000 people under the age of 50 are diagnosed with this disease every year, like my husband Jay. So if you do have any of the symptoms Mark mentioned, if you do have a family history, not only of colon cancer, but of other glandular cancers as well, you need to be very vigilant and talk with your doctor about getting screened.
And Katie, I'm actually the gynecology nag. I'm always trying to get my women to get in for colonoscopy. One question I have, is it okay to try and get them to at least do a virtual colonoscopy first, even though I know that you can't do, take the polyps out and it's not as good as a colonoscopy.
As for the virtual colonoscopy, the latest test shows it can be as efficacious as a traditional colonoscopy. I would just say if they're going to go through the prep, which to me is a little worse than the procedure because, the fact that they call the drink that you drink Go Lightly is such a joke because it does not make you go lightly. I can tell you that from personal experience. But, if you're going to go and do the prep, to me, you might as well get the full-blown colonoscopy. So if there is a chance that a polyp is discovered, as Mark mentioned, you can have that, what is it called, polypectomy? Polypectomy. And it can be snipped by the same device that's actually going through the colon, and then you kind of have one-stop shopping. If you find a polyp through a virtual colonoscopy, you have to go through the whole process again. And I would rather not do that personally.
Right. Oh, thank you. That's great advice.